Okay, hi everyone. I'm Cassandra Lovejoy, sorry. I'm co-director of the Center for Energy Poverty and Climate, and you are joining our second webinar in our series with the National Cooling Standards Initiative. And this webinar is going to be about protecting vulnerable populations from extreme heat. So a little bit before we get started into the speakers, I'm trying not to take up too much time, get into the meat of things. But this is part of a project that we are working on in conjunction with NASIO, with NASIO and the Climate Works Foundation. And the purpose of this project is to work with kind of on the ground with states and PUCs and LIHEAP offices and weatherization offices to figure out solutions to cooling for low-income households. It kind of started from this idea that winter shutoff protections were a lot stronger than summer shutoff protections, and that we needed to be protecting folks better in the summer. And then we realized, well, if we're not going to shut people off in the winter and we're not going to shut people off in the summer, then what we're doing is creating kind of two small periods of time that low-income customers can be shut off from power, and that could end up putting them in actually a worse situation than they currently are. And so we started to think, well, what we really need to be doing is rethinking the entire framework of protections for low-income households, making sure their homes are more energy efficient, making sure that they have affordable energy, and that, risk of shutoff really isn't a problem for them. So we've been doing a bunch of research and conversations about this. We've talked to the public utility commissions. And again, this is a part of a webinar series, kind of digging deeper into that conversation. We have two more sessions in this series. So this one's going to be mostly about kind of the health impacts and connecting that to policy. In session 3, we're going to be talking about state examples of affordable cooling strategies. And then the last one, we're going to get into a little bit of the funding. How do we pay for all of this? So with that, I'm going to turn things over to Chris. Chris, are you ready? I'll do a quick introduction of you.
Sure.
All right. Chris Worsham is with Harvard Medical School. He's going to be our first speaker and be talking quite a lot about the kind of the health impacts and how extreme heat affects the body. And then our second speaker is going to be Catherine Catalano, who's Deputy Director of Climate Health and Equity at the American Public Health Association. With that, I will stop. One more, a couple more administrative items before I turn it over. We are recording this session. It will be available online, both or on the CEPC website. And if you want to ask questions, please put them in the chat. We will have time for questions at the end. So with that, take it away, Chris.
Great. Could I have screen sharing access?
Yes, there you go.
All right, is this displaying okay for everyone?
Yes, it is.
Okay, great. Good afternoon, everyone. My name is Chris Worsham. I'm a pulmonary and critical care doctor. Some of the time and the rest of the time, I am a health services researcher at the Harvard Medical School Department of Healthcare Policy. And I put this talk together along with another critical care doc, Peter Kahn, down at Yale, really with the goal of giving some pretty high level perspectives on the medical aspects of all this and some of the sort of scientific underpinnings of heat related illness. And then, more relevant information to what we're all here to talk about today. So we'll start by just talking about like, what do we mean by extreme heat from like my standpoint as a medical provider? What is a vulnerable patient? How do we as human beings respond to heat, and how do we in the clinical care treat heat related illness? And then I'm gonna hopefully not step on too much of Ms. Catalano's talk on the sort of data that's out there for monitoring this. and some of the interventions. So hopefully we'll segue into one another pretty well. Just doing my normal academic spiel here. I don't have anything related to this talk as far as disclosures. So we kind of need to start out by just talking about like what temperature is dangerous to health. And it's really unsatisfying when we say things like it depends. That's really the answer here. For any given person, what is too hot is pretty variable. So who is that person? What is their medical status? What medications are they on? What conditions do they have? What else is going on in the atmosphere beyond just the temperature? How well can that person hydrate? And I should add to this, how well can that person eat and sort of get solutes and electrolytes? And then how well can that person rest and cool off if they do get hot? A lot of these factors are pretty heavily influenced by what the typical temperature is for somebody. So we need to think about dangerous with respect to that normal, what is normal. And then introducing folks to the wet bulb globe temperature, if you haven't heard of this before. So instead of just measuring the temperature, or I think most of us are familiar with the heat index that factors in humidity, really the gold standard for measuring like how hot it is as far as what the human body is experiencing is this thing called the wet bulb globe temperature, which is adjusted for the the actual temperature, the humidity, and then radiant heat. So whether that is heat coming in the form of sunlight bouncing off of buildings or asphalt, and then how well is that area being ventilated, whether you're outside and it's a breeze or whether you're inside and it's ventilation. So when the human body gets heat, we get it, thinking specifically outside, we'll get radiant heat from the sun, and that's going to be drastically different whether you're in the sun or in the shade, off of buildings, off of asphalt, and that's going to just sort of put heat onto us. And then how do we get rid of that heat? Well, we sweat, obviously, and that sweat evaporates, and when it evaporates, it takes with it some energy. We also just get sort of convection cooling by a breeze can just blow heat off of us and we transfer it into the air. We breathe out some of our heat in the form of warm air and moisture. And then we can do work to get rid of heat. And then if conduction is sort of, if you're sitting on like a cold surface, then you feel that heat leaving. It's another way we get rid of heat. So keeping in mind the wet bulb globe temperature, that factors in all of the ways we absorb and dissipate heat. There's different systems to guide outdoor activities. We have one that's sort of like student athletes and another from OSHA and the military. But they all come down to these four important factors. So what is the wet bulb globe temperature? What is typical for that region and how outside of the norm is it? What is the health and fitness of the person who is going to be outside, and what are they going to be doing outside? So, we have outdoor construction workers are doing something a lot different than a little kid playing baseball, but at the end of the day, there's a lot of important considerations that go into determining whether that heat is extreme for them. So who is vulnerable? Well, we're all vulnerable to heat. The questions really are who is the most vulnerable, who needs special preparation for extreme heat, who would benefit from proactive interventions, the sort of preventive type things, and then who is going to struggle reacting to hot weather. So these are who I would consider vulnerable. The CDC kind of says, taking all those combined, our most vulnerable groups are children, older adults, adults with disabilities, I guess children and adults with disabilities, and then people working outside. And then generally, males tend to be more affected than females. A lot of this has to do with who is working outside, but also just differences in our body composition and how we generate and dissipate heat are there. So how do we get to these four groups? Like, why is it these groups that are most affected? If we take into some of the factors that are generating heat, if you're working outside, you're going to be affected by the temperature, the humidity, and the wind ventilation. And you're also going to be generating a lot of heat by doing work, whether you're lifting things, at a construction site is a kind of obvious example. With children, they are small, and their sort of ability to dissipate heat and sweat is just not as robust as an adult. And then we also have to factor in that children might have difficulty recognizing signs of dehydration or that they're getting too hot. And then those sort of cognitive issues also affect older patients who may, people with even mild dementia may not recognize signs of getting overheated. And then older folks also just do not sweat as much as younger folks, and it is more difficult for them to dissipate heat. And then when we're also talking about older folks and people with disabilities, there are a host of medical conditions and medications that really affect our ability to cool down. So if you have heart disease, it's harder to pump blood around your body, get it out to your skin where it can release heat. If you have, diabetes, vascular disease, getting blood out to your skin to cool off is more difficult. There's things like cystic fibrosis where the composition of sweat is actually different, and so it's harder to dissipate heat that way. And then people with things like spinal cord injuries, their nervous system's ability to sort of generate sweat can be a lot different than a patient without that condition. And then there's a number of medications, particularly psychiatric medications, that directly impair our ability to sweat. So then we start to think about who else is vulnerable. And if we take these same factors and think about who is without resources and impoverished patients, these are people who are more exposed to the environment. Maybe they are living outside or living in very close quarters in high population density. They might be working more outside and generating more heat. They might have disabilities or other changes. We have disability can make people, less robust financially and have fewer resources. And then also people with fewer resources are more likely to develop medical problems. So we get in that cycle there. So these same factors that put those four groups particularly susceptible to heat-related illness, the same goes for impoverished patients. And if we're just sort of talking the medical nitty-gritty, once things get out of control and people start to get actual heat-related illness, you get simple dehydration where they just need more fluid. You can get heat cramps, which is the muscles not working because they're dehydrated or their electrolytes are off. And then there's heat stroke, which is life-threatening and requires emergency treatment and generally admission to an intensive care unit. The other thing is when the temperatures are very high, all of the sort of general regular causes of death can increase. So cardiovascular disease, heart attacks is a leading cause of death. They are higher when it's very hot out. The body's under a lot of stress. People who have breathing problems, COPD, asthma, it gets worse when there is more heat. And so all of the regular things that land people in the hospital can just be amplified when during periods of extreme heat. Then on the other side of things with these indirect impacts, we have a lot of stress on the healthcare system, stress on emergency medical services. We have more work-related accidents because people are dehydrated or hot. You can potentially have food supply issues with, insufficient refrigeration. And then, the electrical grids are under a lot of stress during heat waves, and that disruption of infrastructure can have sort of wide-ranging health impacts. So this is just what we're talking about when we're talking about heat stroke. This is a patient with heat stroke, and we literally just either put them in a bath of ice or cover them with ice and put cooling pads on them to bring their body temperature down. It is extraordinarily dangerous for your body temperature to be higher than 104, 105 degrees. That is what happens in heat-related illness is once your body loses its ability to dissipate heat, it starts to get too hot. So the basics here, a lot of these are obvious, but just to say them, we want people inside, but as long as inside is cool, you need to go somewhere that's cool. If you're outside, stay out of the sun, especially midday, get in the shade. Cars can get very hot very quickly in the sun. If you're living, you got to keep your living space cool. If you don't have air conditioning, If you can get air conditioning for one room, that's better than none. You can spend time in that room. Block out sunlight from the windows. Fans, if they're just blowing hot air on people, are not often that effective at cooling them down. And then avoiding strenuous activity. I put your mileage may vary here because depending on who you are, what is strenuous has a different definition. People who get hot, we want them to, these are all things that kind of should happen before they make it to medical care. Cool down, take a cool shower, wash off, cold sponge baths, cold packs, wear light clothing, drink water. We also have to remember that eating food is also necessary to sweat. You need energy to sweat. You need electrolytes to go into your sweat. And then vulnerable people might need assistance with tasks when they don't normally need help. We need people to check in on older folks. And then we really need proactive medical interventions, particularly people on psychiatric medications. So as far as helpful data tracking here, the CDC has this heat and health tracker, which is based off of the National Syndromic Surveillance Program, which absorbs a bunch of data from emergency departments from a lot of counties in the United States. So most counties, not all counties, but this is actually a very good tool to monitor how things are going as far as heat-related illness ending up in the emergency department. You can then see that individual jurisdictions have their own thing oftentimes. This is Maricopa County in Arizona. And a lot of these systems are actually the same thing. This is the county level thing that's getting fed into the national system. You can track them with, this is New York City's, same idea. One caveat on this though, is that if a patient is coming into the emergency department and requires medical care for heat-related illness, that is a tip of the iceberg for difficulties dissipating heat in the community. So one sick patient ending up in the emergency department tells you there's a bunch of people struggling at home, that there's a lot of failures of these preventive strategies. And we have to keep in mind that a dead patient doesn't show up in the emergency room. And if you're not tracking heat-related deaths, which can sometimes be hard to determine, you're kind of missing the entire picture. So other options, and again, I was looking for research on this, but I haven't seen much, but like Google Trends, right? This is in the Phoenix area over the past 5 years. When are people searching for air conditioning? Maybe they need air conditioning, maybe they need a repair. You could sort of follow what people in the community are thinking about. Smart thermostats, we can try to undo this headline. There's a lot of issues related to smart thermostats, but if they are collecting temperature data, you can very easily see what kind of dangerous temperatures are actually occurring in the community. So from a medical standpoint, how would we intervene on this? There's a lot, we have the underlying issues, climate change and infrastructure that I think are pretty obvious for most people. We need to promote awareness, but it also can't just be like, hey, it's going to be hot outside. It needs to be education with real sort of tangible recommendations. And people need to know what they should look out for and then also what they should do. So my orders, and this is my medical opinion and not sort of established by any sort of organization, but we need to plan ahead. So we need to know who is the most vulnerable and what resources are available before the heat wave comes. Planning for increased need for medical care, but also recognizing that if people are needing that extra medical care, you are failing on the front end. We want people to stay cool. So air conditioning needs to be affordable for at least one room. Avoiding electrical service interruptions. People ask me all the time, you know, as a doctor, what do you recommend about who should we interrupt electricity to for disconnections? And I said, nobody. Like from a medical standpoint, I don't care if you're not paying your bill, you need your electricity. That's not just disconnections. Obviously, grid infrastructure is very important here as well. People need affordable access to water and appropriate food. Affordable access to appropriate clothing and bedding. And then we need to make sure that people have access to active cooling when they need it. Cooling centers, splash pads, pools. Pools can be problematic because they present their own dangers, but they are often important. And then we have to keep in mind who are the patients we really need to cool down. You have a cooling center that's far away. If someone is wheelchair bound, they have a whole host of risk factors for heat-related illness, and that make them extra at risk, and it's also extra difficult to get to that cooling center. And then we need to be being proactive about looking out for people who are particularly vulnerable, and then make sure that we take advantage of all the data we have. So I want to turn things over to Ms. Catalano so that we have time for good Q&A down the road.
Yes.
Thank you, Chris. And I'll just turn it, Catherine looks ready, so I'll just turn it straight over to her.
Great, thank you. Can folks see my screen?
Yes, we can.
Thank you, great. Thank you, Chris. Thank you, Cassandra and everyone at CEPC. My name is Catherine Catalano. I use she, her pronouns. I'm the Deputy Director of the Center for Climate, Health, and Equity at the American Public Health Association. And I am very glad to be here speaking with y'all today about protecting vulnerable populations from extreme heat. If you are, try to get the slide to advance here. There we go. If you are familiar with the American Public Health Association, we are a professional association for the public health field, and public health professionals from all different walks, from folks at health departments to doctors and nurses and social workers and community health workers and academics. We champion the health of all people and all communities. We strengthen the public health profession, promote best practices, and share the latest public health research and information. And then within the American Public Health Association is my center, the Center for Climate, Health, and Equity at APHA. That's our team right there. I just always want to give them a shout out because their hard work contributes to pretty much anything I walk around and talk about throughout my workday. We promote policies and practices that address climate change, environmental justice, and health equity. I may accidentally have this set to a timer, which is going to be really annoying. And we spur action among our members and members of the public. We support science that clarifies the health and equity impacts of climate change and help translate that science to communicate to broader audiences and raise awareness across the US. So I spend a lot of my day talking about the health impacts of climate change broadly. As you can see here, a lot of those impacts are interconnected. Rising temperatures is definitely one key area that also then influences others. Air quality is much worse. I don't know how to make that stop. Air quality is much worse when temperatures are warmer, ground level ozone or smog is created. The rising of temperatures over time helps, spread vector-borne and waterborne diseases further, creates more extreme weather events. And then the rising temperatures and extreme heat itself has a lot of different health impacts. So I'm going to focus on that today. These, I always like to set a little bit of context from the right now and say that these headlines were all pulled this week. Actually, three of them are today. The Guardian headline was from Monday. But extreme heat continues to be an issue, continues to get worse. In the US and around the world, and folks are more and more aware of it. Extreme heat events are dangerous for our health and are actually the leading cause of death and heat-related illness among natural disasters and extreme weather in the United States. So heat kills more people than floods and hurricanes and other natural disasters. Extreme heat actually kills more people in the US than all other weather events combined. So I really want to drive that home, that while folks connect heat to climate change and they're aware it's happening, I think a lot more public education is needed to really make folks see what a huge danger heat can be to their health. For every 0.1 degrees Celsius of warming above present levels, about 140 million more people will be exposed to dangerous heat. And by mid-century, nearly 2/3 of Americans will experience perilous heat waves, with some regions in the South expected to endure more than 70 consecutive days over 100 degrees by mid-century. Those are just current projections. So when talking about the health impacts of heat, which Christopher did very well as well, so I won't belabor it too well or too much because I want to move forward here. But you know, we can suffer from dehydration, heat stroke, aggravated cardiovascular and respiratory illnesses, and there are mental health and brain health impacts from heat as well. During heat waves, you see a rise in stress, anxiety, aggression, violence. A lot of that can happen, as has been seen during heat waves as well. Summer of 2023 was Earth's hottest since records began. And what I'll talk about more in the next slide is this urban heat island effect. Urban neighborhoods can be up to 20 degrees hotter than outlying areas with more trees and less pavement. It's called the urban heat island effect. So I will move forward and talk a little bit more about that. This effect drastically heats city centers and disproportionately leaves low-income and communities of color hotter in the summer months. So Christopher had actually a similar diagram showing the human body and the different ways it heats and cools. So here I'll give that to you, but in terms of a city, in terms of a city or a neighborhood, which has a lot of the same principles, the same way that the human body cools down through evaporation, through sweating. Cities cool down through trees evaporating water, through different bodies of water. So those can have cooling effects on cities. While the sun heats our cities, heat from vehicles and from absorbed heat in the road surface, heat from just human activity and energy in buildings, heat from air conditioners, actually the primary way that many of us cool ourselves, actually can increase the heat of the city. And that's something we're trying to teach a lot about right now, is really thinking about the heat of the city as a whole in this public health approach to combating extreme heat. We have to run our ACs more when our surrounding area is hotter. It heats our buildings. We have to do more, expend more energy to cool, and that just continues to elevate the issue. An urban heat island occurs in cities when the natural landscape is replaced by pavement, buildings, and other surfaces that absorb and retain heat rather than reflecting or transforming it. So as a result, the materials create a hotter environment than rural areas. Temperatures can range from 5 to 7 degrees hotter during the day and can increase as much as 22 degrees at night from a dense urban area to the surrounding areas. The heat island effect leads to increased energy costs, air pollution levels, and heat-related illnesses. Low-income populations are at risk because they're more likely to not only to live in neighborhoods that have fewer trees and green spaces, which would lower temperatures on the whole, but low-income families will also generally have a higher energy burden, or the percentage of their income that must be spent on energy for their homes. So some will try to lower energy costs by not running the AC as much, making them more vulnerable via exposure to indoor heat. Extreme city temperatures are also particularly dangerous for other vulnerable groups, as Christopher mentioned: children, elderly adults, people with pre-existing health conditions, and those with higher risks of exposure, like outdoor workers, unhoused populations, and student athletes, and those whose resilience has been hampered and whose exposure is increased due to disinvestment and marginalization, like low wealth communities and communities of color that have seen less investment in parks, in tree cover, in these things that can help lower temperatures for an entire neighborhood. Which brings me here to this map on the left. I'm using the city of Baltimore as an example. You can see that this heat island effect, you know, right here in front of you, lots more heat in that central core, lots more cool temperatures in those outlying areas with more green space. And actually, this right here, this map shows, I believe, a 14-degree difference in Baltimore from higher income areas like those around Roland Park. You see up there, even just sort of just outside of that red core, as they were about 14 degrees cooler than some of the lower income neighborhoods down here in East Baltimore. That was on the exact same day in 2018. Those temperature readings, 87 degrees and 101 degrees Fahrenheit on the exact same day. This map, and this is something we always like to do, is put it up next to a redlining map from the 1930s. For those who aren't familiar, redlining was the practice of categorically denying access to mortgages and other loans, not just to individuals, but to whole neighborhoods. In the 1930s, the federal government created redlining maps for almost every major American city. If residents of a neighborhood were African American or to a lesser extent immigrants, they were deemed a threat to the stability of home values, and lenders were encouraged to stay away from those areas. Housing value and quality dropped over time, and other government investments often skipped over these redlined neighborhoods. To this day, even though this was, a practice started in the 1930s and these maps were created back then, to this day, these maps continue to align with all sorts of health, environmental, and structural inequalities, from prevalence of asthma and certain kinds of cancers, to parks and tree canopy, to whether bus stops have safe covered shelters or how many bus stops there are. So decades of underinvestment in these neighborhoods, in parks and trees and better city surfaces in low-income communities and communities of color have made these areas hotter, more prone to flooding, and less livable. So just want to share that background for that particular layer of vulnerability. You can see here as well, this is from American forests. So there's 33% less tree canopy on average in neighborhoods with majority of people of color than majority white communities. This is even when you take income or wealth out of it. And then 41% less tree canopy in neighborhoods with 90% or more of residents living in poverty than communities with only 10% or less. So that, with that background on health impacts and on vulnerable and marginalized groups, I want to talk about a project that we have been working on. Our center has partnered with the Smart Surfaces Coalition. It's a coalition of 40 organizations, including public health, environmental, and building industry organizations working to create cooler, healthier cities through innovative building materials and design strategies. We're trying to cool cities as a whole. APHA is part of the Smart Surfaces Coalition and a founding member of the coalition because we recognize the connection between our built environment and public health. These are some of the other funded partner organizations on this project that I'll talk a little bit more about here. There are many more partners that contribute in other ways as well. So the Cities for Smart Surfaces project, we're working in 10 US cities to try to encourage the adoption of smart surfaces, of changed building materials, of changed building codes at the metropolitan level, and working with communities in these regions to support community-led local smart surfaces implementation projects. Let me Okay, great. So what are smart surfaces? They offer passive cooling strategies that are more sustainable and equitable than relying solely on air conditioning. We're cooling cities. These are some examples. Cool roofs and pavements reflect sunlight and reduce heat absorption by buildings. Urban forestry programs increase tree cover, which provides shade and reduces air temperature. And light-colored building materials reflect heat instead of absorbing it. Certain smart surfaces interventions are very simple. You see in that top left picture, painting pavements, not necessarily fully replacing them, right? This is one of the lower cost interventions, just making them more reflective. Obviously, it's a special paint that is very durable, but this is just one example in addition to tree planting, in addition to solar voltaics, which take heat and convert it to energy instead of transmitting it and storing it and putting it into our buildings. Energy efficient building codes can ensure new construction is designed to stay cool and minimize energy use. Trees reduce temperatures through shading and evapotranspiration, like we talked about. Tree canopy shading effects provide the coolest temperatures among all of these choices. They actually tend to have the biggest impacts. And they also, turn CO2 into oxygen, help fix carbon, remove pollutants from the air, provide shade, and reduce flood risk. So we're a big fan of trees over here. Cool roofs and pavements are engineered to reflect the most sunlight. The shift from dark to light surfaces can result in a 40-degree Fahrenheit cooler temperature if it were to happen in an entire city immediately. Obviously, that's not super realistic, but we're trying to really start putting these policies into place so that this is prioritized in new constructions and that trees are planted and some of those other easier interventions are continued to be adapted. Benefits include reduced heating, lower energy costs, reduced air pollution, and greater pedestrian resident comfort. So I just wanted to show a picture of what that sort of looks like here. Before smart surfaces, this is, not the prettiest block. It's a lot of dark pavement, a lot of metal, dense buildings, brick, all of these things are absorbing and retaining heat and making this area hotter. Here is that same block. I'll go back and forth a couple of times so you can see the big difference with an imagined smart surfaces interventions. You've got lighter concretes reflecting more of the sun's heat. You've got more green space, more shade. Just an example of what these interventions can look like in real life. Citywide smart surfaces can reduce summer temperatures, provide energy savings, help combat the other effects of global warming as well, and help protect public health. So I'll talk a little bit about using public health data to inform policy as well. We were talking about this earlier, or Christopher was. This is a really key point here. Public health data is essential for understanding the health impacts of climate change. By tracking this data and using it to inform policy, we can see a clear correlation between extreme heat and negative health outcomes. And it can be analyzed to identify vulnerable populations and develop targeted intervention. Where do we need to put cooling centers? Where do we need to plant more trees? Public health data is key for being able to shape and direct these policy interventions, and is something that we're relying on very heavily in the Smart Surfaces Project. Data can guide, cooling centers, public education campaigns, and investment in heat-resistant infrastructure. So Christopher also talked about the CDC's health tracker, and they just very recently released their heat and health index, where it can identify based on a number of factors. It'll sort of give you a number on where people are most likely to feel the effects of heat on their health. It combines historic temperature data and emergency medical services data on heat-related emergency responses from the past 3 years, as well as data on community characteristics, including pre-existing health conditions, sociodemographic information, and characteristics of the natural and built environment, those city characteristics, to provide their final heat and health index rating. Which I'll just show an example here. This is you put in a zip code. This is a zip code I used to live in when I lived in Florida, which is where I'm from. And it says that this zip code is in the top 77% of the country. That's based on historical heat and health burden, sensitivity, sociodemographic factors, and natural and built environments. Sort of defines all of those for you. And then you can toggle through and look at those different factors and see more specifics. I've shown the natural and built environment one since I was talking about smart surfaces. So you can see that this index does take into account the amount of impervious surfaces in that zip code, lack of tree canopy, people who are walking and have no vehicle, the amount of ozone and particulate PM 2.5, which is particulate matter, air pollution. Those are two of the most dangerous and prevalent in our cities. And how much of the population there is renters and may not have as much control over their cooling capabilities. Oh, this slide didn't load the rest of the way, or I didn't save it. But I did want to say that we are doing a webinar with the CDC on July 18th to talk through ways to use their newly launched Heat and Health Index. So I can send more information around later. We don't quite have the registration link ready, but definitely keep an eye on our website. And that will once again be on July 18th. So mark your calendars. Just some other public health data sources, sort of at the national level. There are several CDC programs that are great resources, EPA programs, NIEHS programs. And then I just really wanted to drive home the importance of partnering with your state and local health departments. They collect data specific to their communities, critical to understanding local vulnerabilities. They live there and work there. Many of them do climate and health assessments, even those that don't have valuable communicable disease data and chronic disease data. And public health professionals are often connected with the communities. They need to be consulted in this work, in any work. I think we need to make sure that public health is included in all policies when developing programs. That's often limited by capacity, by funding. There's not always a lot of interagency collaboration. Also, just the lack of mandates in policy for things like health impact assessments in many state, local, and federal policy areas that would benefit from those. Agencies need to be talking to each other, and health experts, can be very valuable at the table, not just for providing access to data and recommendations, but also for engaging with the community in the areas that are being served by certain policy interventions. And I think that's it for me. I hope I didn't take up too much time and we have plenty of time for Q&A, but thank you for letting me come here and speak to you today. And I'm looking forward to the discussion.
Thank you, Catherine, and thank you, Chris, as well. We are going to open it up for questions now. If you have a question, you're welcome to raise your hand. You can also drop it in the chat. And as we wait for folks to start formulating their questions, I think I have a couple for the group, for the speakers to get us started. First, I think this one is kind of for Chris. One of the, as I mentioned at the top of the call, one of the reasons that we started this project is we noticed that there seemed to be a lot more robust protections in the winter than in the summer. Is there any kind of health basis for, is cooling more complicated? Is extreme heat more complicated to deal with than extreme cold, or is this some sort of a policy mismatch that we have on our hands?
I think both things are true. So, I'm biased because I live in Boston, and there are, with the weather around here, there are many months, stretches of the year where, exposure to the cold is a problem, and it just impacts a much larger percentage of our time than heat waves here. And that's true for many parts of the country. But if you look down in like Maricopa County in Arizona, they're obviously much more concerned about the heat than the cold. But when we talk about these protections, right, if we're talking about cutting off somebody's heat in the middle of the winter, we're talking about months and months and months of exposure to the cold. If we're talking about protections against electrical disconnections, we're talking about a problem during a heat wave. If we're most interested in sort of these acute, dramatic heat exhaustion type things, I think some of the data that Ms. Catalano presented about sort of like the general problems that come up when things are generally hotter. We tend to undervalue that people, cognitive function is worse, violent crime goes up, domestic disputes go, like all these kinds of things. We don't worry about them as much as that dramatic image of a construction worker passing out because it's so hot outside. So I think it's a little bit of both. We need to learn more about the effects of heat, but do recognize that these are different problems and there's a lot of regional differences in what we do have to prioritize.
I'll also just add on, Sandra, yeah, I agree with everything Christopher said. And heat is getting significantly worse due to climate change and over time. It is a regional difference, but less so than it used to be. And I think that is a problem that public policy does have to catch up with. There are areas in this country where, I'm from South Florida. And air conditioning is in every single residential unit that was ever built in South Florida, because that was always a necessity. There are parts of this country where that's not the case. And now heat waves are becoming more deadly in the Pacific Northwest because they don't necessarily, they haven't been historically prepared for it. Because the climate is changing, heat is spreading. I moved to Washington, D.C., and I thought this will be very different. But the day I moved in 8 years ago, it was 103 degrees. And I said, I thought I came north. So, these things are, it is true, it is more complicated and it is regionally different, but public policy needs to prepare for this to continue getting worse. It's just, we tend to legislate for the reality that we know and not necessarily trying to take into account all the possible projections. And that's something that we need to hurry up and address in a lot of areas in this country.
Thank you. All right, next question. So one of the problems when you're looking at the built environment, especially when you're looking at low and moderate income households, is that a lot of them don't own their properties. It's a lot of rental units. And it's also a lot of existing infrastructure. And I know that when you're looking at, a lot of ways to reduce ambient temperature, you start talking about new builds, and there's seems to be a little bit less that you can do in existing infrastructure. So considering kind of the constraints that we're looking at within, existing infrastructure and renters, and maybe is there a role for landlords in this, kind of how should we be thinking about all of these issues in those terms?
I can just say, yes, is the is the short answer. I think, there are several groups where it is a little bit easier to create policy and accountability around. Landlords is one of them. A lot of cities, like you said, have requirements for heating available in rental units that don't have the same requirements for cooling. That's, again, policy needs to catch up with the reality of today. Same with employers, are easier to create policies around occupational health and safety, types of policies. There is very much a role for regulations there, and certain cities, certain areas are catching up at different paces, or different, there may not be an explicit standard, but courts are starting to include like, for instance, in habitability requirements for rental units, certain policy is now being interpreted that is a little more umbrella to include cooling and heat health concerns in residential units. When it comes to occupational health and safety, certain worker protection and workplace harm reduction standards are starting to be recognized in court as to include heat-related dangers. And while that's great, it's definitely time to create more specific requirements for those groups. Absolutely.
And I think there's a lot of opportunity for finding common interest, right, between like landlords and a city government or something. If you want to develop, put some green space in instead of a giant block of concrete on the ground, you want some trees, you want some grass and plants. That's good for home values, right? That people want that. People want to live in a city that has shade when they're walking around and things like that. So you can find those opportunities, and sometimes one group can drag along the other group, as frustrating as it may be. And we see that like around the world, that some of these like urban forestry initiatives were met with a lot of resistance and then do really well, and then landlords are excited about because people want to live there.
Thanks so much, Chris and Catherine. And I see that there is a question related to the Smart Surfaces Coalition that I think, Catherine, you had a slide on, just like where it is relevant, where like whether there's involvement from Phoenix, I think was a specific question.
Yeah.
But I also know that that's been a topic of interest for state energy offices in particular. So any information on how others that aren't already involved can get involved could help.
Absolutely. So the 10 cities that the Smart Surfaces Project is focused in right now, this doesn't include, so we sort of piloted in Baltimore first, and actually just this past year got a smart surfaces like cool roofs ordinance passed and signed by the mayor, and that was like a really wonderful step. And so now that then sort of after piloting our coalition's efforts in Baltimore, we've now expanded to 10 new cities. So where we are working actively currently is Portland, Oregon, Boston, Massachusetts, Charlotte, North Carolina, Columbia, South Carolina, Atlanta, Georgia, Jacksonville, Florida, New Orleans, Louisiana, Dallas, Texas, San Antonio, Texas, and Phoenix, Arizona are the 10 metropolitan areas that we are currently active in. We are working through several national partners that are working with their state level or local level affiliated groups or chapters. We're working with faith organizations and faith communities, various church communities in all these different cities, and different like local NGOs, as with the cities themselves. So this is actually an initiative that we invited cities to apply to be a part of, basically to say, yes, we want your technical support. We're creating a cost benefit analytic engine for each city that shows different policy interventions and what kinds of health and energy benefits, et cetera, will come from that. So before putting in all that work, we sort of had to get an affirmative from the cities saying like, yes, we want this, we want to work on these policy things with you. And we want to learn more and, commit a certain amount of like time and energy to exploring these options. So that's lovely. So yeah, we're working in cities where folks, either their sustainability offices or other parts of the mayor's offices are involved with us in some way or another in each of these two. For folks that live in those areas and want to get involved, you can definitely go to our website and reach out that way via the Smart Surfaces Coalition, or reach out to me and I can connect you to a relevant partner. We work through our state public health associations, but there are other partners that might make more sense to plug in with. So I definitely encourage reaching out. I'll put both of those, the website and my email, in the chat momentarily.
Thanks so much, Catherine. Cass, did you want to jump in with any other questions?
Yeah, I had another question for the group. There's some conversation in the chat going on about the smart services and NASU's involvement. And by the way, if you're not following the chat, you might want to check that out as well. One of the kind of recurring themes that has appeared during this project and on some of these webinars is that this issue is bigger than us, right? The state energy offices can't do it on their own. The public utility commissions can't do it on their own. The LIHEAP offices, the weatherization offices, we can't do it on our own. And we, we have to be bringing in partners, and not just our own traditional partners, but folks in the health sector, in the housing sector, in, landlord tenant law, in kind of all kinds of partners that we wouldn't traditionally think of working with. What, what role do you see the health sector, Medicare, Medicaid, kind of playing in all of this? How should they be involved? How should we reach out to them? All of the, and kind of in the bigger picture, what are they already doing, if to address some of these issues? That's too big a question. The one that keeps coming up for us is Medicare and seniors aging in place. And if there's a push for folks to be staying in their homes as they get older, you get more vulnerable to heat. And so are there steps that Medicare and Medicaid are taking to help seniors stay in place and stay cool?
Yeah, I mean, I think so. State Medicaid programs vary as far as with the kinds of things they will cover and how creative they're willing to get. And then you also see some of these programs a lot of times focused on dual eligible Medicaid, Medicare patients, where they can get really creative about finding ways to keep people healthy at home. But I'm one of those people who absolutely thinks that like an air conditioning unit for the bedroom is a healthcare device, just like a wheelchair or a walker. That electricity costs to run your air conditioning unit, obviously at a reasonable rate, should also be something that is a healthcare cost. A lot of these things kind of end up as invisible healthcare costs to people, most of whom are on fixed incomes because they're older or disabled. And so, yeah, I mean, this is a great question. I think the answer is that we need to start being a little bit more creative about how we think about health and paying for maintaining health rather than treating sickness alone.
I agree. Public health, the prevention message, shout that from the rooftops, absolutely.
Great, thank you. Do we have any questions from the group? I want to make sure that we're leaving space for anybody who wants to add anything or has any questions that they would like to have answered. Great, thank you, Chris, for putting your contact information in the chat. And I saw Catherine, you put yours in the chat a little bit earlier. I think unless we have any additional questions from the group, then I think we'll go ahead and wrap things up. Thank you, Chris. Thank you, Catherine, for joining us today. We really appreciate you taking the time, and we really appreciate you guys lending your expertise to this issue. It's one that we hope to continue to have conversations about as we go. Jasmine, do you have any other closing comments or any other?
No, but appreciate all this great context as we continue to work with state energy offices to drive forward some recommendations and actions to support residential cooling and beyond. Thank you so much for your time.
Thank you.
Thank you all.